Sensory processing disorder, or SPD, is a condition that exists when sensory signals don't get organized into appropriate responses.
Hey Patrick, when is that test?
Oh God!
Oh God, I'm so sorry. Nobody saw that.
SPD can be treated with occupational therapy, where the person with SPD and the therapist interact in a sensory-rich environment, which can include swinging, spinning, auditory and taste opportunities that allow the person with SPD to create new neural pathways or strengthen old ones.
Hey, when's that test in biopsych?
Oh, hey, how are you today? You wanna back up? So,
Since Travis has sensory processing disorder, we should probably interview him. I mean, that makes sense to me. So we can ask him questions like what senses kind of affect him.
The cause of SPD is mostly genetic, but environmental factors are also involved. As we talked about earlier in this class, being in a noisy ICU with harsh lighting could affect infants in their brain development, and this could later lead to a diagnosis of SPD.
First off, I'm not actually diagnosed with SPD. So my roommate, his older brother, has SI, which is a sensory processing disorder. And I went and lived with them over the summer, and I was just sitting in the living room, and they have a candle in the living room, and I couldn't handle how it smelled, so I started tensing up and kind of panicking, I guess. And so I got away from it, and his mom asked me what was going on. And I explained to her that sometimes, certain smells or the way things feel, just I can't handle it and I freak out, or just other things happen. And she started telling me about her oldest son's sensory processing disorder. And she's like, I'm pretty sure that's probably what you have too, or something similar. Pretty much, I'm hypersensitive when it comes to touch and smell. Sounds, more or less are balanced to a point, I guess. I can handle more sound than the other senses, but as long as it's just sound. So if I'm in a very loud environment trying to focus on something and somebody bumps into me or something like that, it's almost more of a shutdown than if I was just overstimulated by just one. It's just everything just collapses.
SPD is also found to be in conjunction with autism and ADHD, and the symptoms among them are similar. A person is likely to have both of the disorders at once, but autism and ADHD affect a different part of the brain than SPD does. In a 2013 study, brain scans showed that children with SPD have more white matter toward the back of the brain, where most sensory processing takes place. Children with autism or ADHD have more white matter in the front of their brains.
No, not really. So certain feelings, touch will do it. Smells, so with smells, not always does the same smell make me react the same way. Sometimes it has to do with the amount of input that I've had at the time of the smell. One smell that I know that normally gets me every time are Lysol wipes. The smell of Lysol wipes are just, I can't do it. I panic and have almost an anxiety attack. Which is weird because Clorox wipes are different. They smell different, and they don't do that to me. Touch-wise, it's just our feelings are generally consistent. Certain textures I can't handle a lot. For example, a negative feeling would be cotton. But then there's some that are also positive. So if I get overstimulated, there are certain things that I can do that are also sensory things that will de-escalate like the panic and everything going on. And for example, like right here I have this blanket, so like I just like the way how this feels. It's just like a throw blanket, and so if I get overstimulated by something, I can just lay there and just feel the blanket, or just like hold the blanket, and it just like, I like how it feels. So like it's just kind of like a de-escalator. It's not really working right now.
It's not bothering you?
No, not that much. Like that, and I'm pretty, like, I'm tensing up. I can't really see it.
Does it bother you if you do it faster?